Scabies is a skin disease caused by a tiny parasite, the mite Sarcoptes scabiei, not an edible insect. As winter approaches, these mites tend to increase in number. In places where hygiene is poor, the mites spread more easily, moving quickly from one person to another. This leads to the appearance of strong and very recognizable symptoms. So, what exactly is scabies? What are its main symptoms? How does it spread from person to person or even from animals? How can a doctor confirm the diagnosis? What are the key treatment steps, whether soothing creams or oral medications? Which options are safest for children, pregnant women, and infants? And finally, what advice should be given to patients and those living with them? Stay with me. Peace be upon you all. I'm Hussein Lotfi, and you are watching the Octopus Pharmacist channel. Welcome to a new episode of the Octopus Pharmacist Derma series, where we focus on one specific skin problem each time. At the start, here are today's main topics. If you're looking for a certain subject, you can skip forward 1 minute to where it begins. But if you want to learn everything about scabies from start to finish, then stay with me until the end of this video. As always, let's begin with a story and understand what is scabies and where does it actually come from. The parasite that causes scabies is called Sarcoptes scabiei. It is not an insect, but rather a tiny mite. It is described as an obligate parasite. What does this mean? It means it cannot survive away from a living host. It must stay on the skin of a human being, or sometimes an animal such as a dog or a cat. How does it spread? Mainly through direct skin-to-skin contact. Usually, this happens by touching hands. It is much less common for it to spread through objects like brushes, clothes, or bedding. So, the main path of transmission is direct contact. Scabies can affect both children and adults. It spreads more quickly in crowded places like hospitals, schools, prisons, or refugee camps. And during winter, when the weather is cold, people often gather closer together. This makes it even easier for the mite to pass from one person to another. Now let's look at how this parasite lives and multiplies. Each female mite lays about 3 eggs per day. The lifespan of the mite is around 2 months. The eggs hatch within 2 weeks, and the young mites grow into adults capable of laying more eggs. Once a person becomes infected, the symptoms of scabies usually do not appear right away. They start to show after about 4 to 6 weeks. By then, the mites have already laid many eggs and spread under the skin. And what are the symptoms? The most important one is severe itching, especially at night. Along with this, roughness and irritation appear on the skin. But why does scabies cause such strong itching? There are 2 main reasons. 1. The mite digs tiny tunnels under the surface layer of the skin called a stratum corneum. These tunnels, known as burrows, irritate the skin and cause intense itching. 2. The eggs themselves, when laid inside these burrows, also increase the irritation. And there is something more. The mites are most active during the night. At night, they leave their burrows to feed. They feed on skin cells and natural skin fibers. This nighttime activity is why the itching becomes much worse at night. Because of this, many patients cannot sleep. The itching becomes so strong that it wakes them up, causing serious discomfort and exhaustion. Stay with me. The second topic for today is this: how does a doctor diagnose scabies? What exactly does he ask about, and what does he look for? The first step is always the patient's history. The doctor begins by asking about the symptoms. Then, he asks about the exact places where these symptoms appear. The most common areas where scabies shows up are between the fingers of the hands, between the toes, around the waist and buttocks. It may also appear in other sensitive sites, such as under the elbows, between the thighs, in the genital region, and sometimes near the urethral opening. From here, the doctor moves to the physical examination. He looks carefully for very small, thin lines on the skin. These lines are usually about 1 to 1.5 centimeters in length. They are called burrows, the tiny tunnels where the mite hides and lays its eggs. The third point is the timing of symptoms. Almost always, patients say that the itching is present during the day, but it becomes much stronger and more unbearable at night. We already know why, because the mites are most active during the night. Another important clue comes from the patient's previous treatments. Many patients think their problem is only an allergy or eczema. They try antihistamines, cortisone creams, injections, or different lotions. But none of these work, and the itching continues. At this stage, the doctor begins to strongly suspect scabies. To confirm, he may use a dermoscope, a special magnifying device to look closely at the skin. Sometimes, he also applies a light dye, such as gentian violet, to highlight the burrows. With these tools, the doctor can often see the mite itself, its eggs, or its burrows very clearly. The third topic today, and this is the most important one, is the treatment of scabies. We can divide the treatment into 3 main steps. 1. Washing and cleaning. 2. Topical on the skin treatments. 3. Oral treatment, used only when topical treatment fails. Let's go through these steps clearly, one by one. Step 1. Washing and cleaning. The patient takes a full bath. A rough cloth or sponge is used with hot water and strong soap. You may ask, why hot water and why strong soap with sharp smell? Doesn't it irritate the skin? The answer is simple. Yes, this combination is intentional. The hot water, along with the strong soap and scrubbing, helps force the mite out of its burrows to the surface of the skin. That way, when we apply the actual medicine, it works more effectively. Important notes. The rough cloth should be used only once. After bathing, place in a plastic bag, close it tightly, and throw it away. During bathing, scrub the whole body carefully, but give extra attention to areas where mites hide, between the fingers, between the toes, around the joints, and other common sites. After bathing and drying, the skin becomes ready for the next step. Step 2. Topical treatments. Today, we mainly rely on 2 safe and effective options. 1. Permethrin 5% cream. 2. Crotamiton 10% lotion, often known by the name Urax. Other older medicines are no longer recommended because some cause skin irritation, lung problems, or even serious complications. So we focus only on these 2. How to use permethrin. After bathing and drying, apply the cream over the entire body. For adults, apply from the neck down to the tips of the fingers and toes. Pay special attention to the common hiding places of the mites. Leave it on the skin for 12 hours, then wash it off. Repeat the same process after 1 week. For children, the steps are almost the same. But here, the cream is applied over the entire body, including the scalp and face, because mites can sometimes spread there. Again, leave it on for 12 hours, then wash. Repeat after 1 week. Permethrin is considered very safe and can be used even from the age of 2 months. How to use crotamiton Urax. The same bathing and drying steps are done first. Then, apply the lotion to the entire body. But here, it stays for 24 hours, not 12. After 24 hours, wash, dry, and repeat the treatment for a second day in a row. For children, permethrin remains a first choice because it is the safest and most effective. Most patients improve significantly after these 2 steps, washing and applying topical medicine. Step 3. Oral treatment. Sometimes, scabies does not respond well to topical treatment alone. This usually happens in patients with very weak immune systems, such as people with HIV/AIDS, or in a special severe form of the disease called Norwegian scabies, also known as crusted scabies. In this condition, the skin is covered with thick crusts filled with mites. Here, doctors add oral ivermectin. The dose is about 200 to 250 micrograms per kilogram of body weight. It is taken as a single dose, then repeated once after 1 week. Special cases, pregnancy. The safest treatments are washing, crotamiton lotion, or ivermectin. Permethrin is also considered safe. Ivermectin belongs to category B, which means it's been shown to be safe in pregnancy. Breastfeeding, when a mother needs treatment, she should pause breastfeeding for 24 hours after taking the medicine. The best approach is, before treatment, she breastfeeds her baby and stores some milk safely in the fridge. Then, during the 24-hour pause, she can warm the stored milk and feed the baby. Any milk produced during those 24 hours should be discarded completely. So, to summarize, step 1 is washing and preparing the skin. Step 2 is applying safe topical medicines like permethrin or crotamiton. Step 3, only when needed, is oral ivermectin, especially in severe or resistant cases. And with these 3 steps, treatment of scabies can be highly successful. The fourth and final topic, and it is very important, is the main instructions that every scabies patient or anyone living with them must follow. First, the patient should isolate himself for at least 5 days after starting treatment. Second, all clothes, towels, and personal tools used by the patient must be washed in boiling water. Third, for items that have not been used recently or things that cannot be washed, place them in a sealed bag for 5 to 7 days. Fourth, for bedding and mattresses, if they cannot be washed, they should be placed under direct sunlight for 3 to 5 days. Why are these steps important? Because, as we explained earlier, the mite is an obligate parasite. This means it can only survive on the skin of a living host. If it cannot reach a human or animal, its life cycle is broken and it dies naturally. Fifth point, and this is very important. Even after successful treatment, the skin irritation and itching may last for about 4 to 6 weeks. The reason is that while the mites are already dead, the skin still reacts to the remains of the infection. During this period, patients may need simple first-generation antihistamines to reduce itching and help them sleep normally. Finally, if scratching has caused wounds or infections on the skin, then a cream that contains both antibiotics and mild cortisone may be given. But if there are no wounds, antibiotics and cortisone are not needed at all. And with that, we reach the end of today's episode of Octopus Pharmacist Derma. I hope I have shared useful and clear information with you. If you enjoyed this content, please don't forget to like, subscribe, and share. And of course, you can also support the channel on Patreon, PayPal, or directly here on YouTube. Good night. I'm Hussein Lotfi.